tobacco control. So I want to introduce my co-chair, who is Dr. Dean Xuan. Sorry.
You know what? I think I should pronounce my name and he should pronounce his because I can't pronounce his either. But I'm Dean Schraffnagel from Chicago. You say Shale and Wei.
Yeah, Xiaoling Wei. I'm Xiaoling Wei from University of Toronto. So let's invite the first speaker, Norman Maldonado, to talk about his experience in Colombia.
Are you going to speak in Spanish? No. English? Will anyone speak in Spanish? Do you want to say that in Spanish? So we have headsets, and we have the title of the first one is in Spanish, but if everyone speaks in English, then we won't need these. Okay? And you're going to speak in English as well? Okay.
Okay, just a little bit housekeeping rules. We will have everybody 10 minutes presentation, and then we will allow 1 or 2 questions after each presentation. So that will give us about 10 minutes at the end for questions to the general. Thank you, please.
Oh, we should introduce, did you see his title? Did you see his title?
Okay, so good afternoon, everyone. So my name is Norman Maldonado. I'm an economist. And this is a work that we're doing in Colombia, basically to establish a monitoring system for the tobacco tax policy. This is a work in progress by Norman Maldonado, Blanca Llorente, and Andrea Lara. Norman and Blanca from Fundación Nash, and Andrea Lara from the Ministry of Health in Colombia. We have, the authors have no conflict of interest. So this is the presentation. I'm going to talk about 3 topics. The first one is tobacco tax policy in Colombia, kind of context. The second one is tobacco industry interferences. And the third one is the strategies that we are following to counter the tobacco industry interference. So first, some context. Colombia is 48 million people. The population in Colombia is 48 million people. The prevalence in Colombia is 13%. The last time that we estimated the prevalence was in 2013, but we expect to have pretty much the same numbers for today. 4 points. The first one is by June 2016, Colombia had the second cheapest pack of cigarettes in the Americas. I have some numbers here. A 20 stick pack, the price in Colombian pesos was 3,000, but in dollars, that everyone knows, just $1, and the excise tax, I mean the specific tax for tobacco, was just 25 cents. And then, of course, the tobacco tax was one of the reasons for having one of the cheapest cigarettes in the Americas. The second point is the tax reform. So we had a tax reform on December 2016. That reform increased the tax from 25 cents to 50 cents in 2017. 75 cents in 2018, and from then on, 75 cents updated by inflation, I mean consumer price index, and 5 percentage points. So hopefully with these additional points, we will be able to control for our lags in affordability. I mean to catch up in terms of taxes and prices in the Americas. The third point is what happened after the tax reform. Our price right now, after the tax reform, is right below the average price in the Americas. So it's still low, not that low, but it's still low. So we have still a lot of work to do. And we are still way behind on affordability. These are some estimates regarding affordability. And and this is a graph showing our lack in affordability. So we are way behind from other countries in the region regarding affordability. So we have some challenges. The first one is we have a huge gap in monitoring the epidemic and monitoring tobacco tax policies. The second challenge is we have institutional weaknesses regarding tax management. The third challenge is we have an inadequate tracking and tracing system to prevent illicit trade. And the fourth challenge is an absence of a comprehensive border policy. A huge challenge that we have right now is also related to the electronic nicotine delivery systems, I mean electronic cigarettes, but we have no regulation and it's not that related to this presentation, but these are the 5 main challenges for Colombia. Okay, so that was my first point. Second point, how is the challenges that we have in Colombia regarding tobacco industry interference. The first, first, by law, excise tax in Colombia is collected by 33 subnational authorities. So the country is divided in 33 subnational authorities, and even though they have no power to determine how much the excise tax is going to be, they have the power or independence to collect information on tax revenues, and they also have freedom to choose whatever system they want, and that's an issue. Why? Because you will have different systems to report, different platforms, different formats to report the information, and that creates basically asymmetries of information that, of course, are going to be exploited by the tobacco industry. So this is, another problem is that the association of these subnational authorities is funded by the industry. So basically the industry is providing all the funding for collecting the data on tax revenues, which is a big problem. And third, the industry also provides funding and technical guidelines for our tracking and tracing system. We don't have a tracking and tracing system to prevent illicit trade. We are in process of having one. None of the national authorities want to take responsibility for that. But right now, the only proposal that is around comes from the industry. So of course, it's an issue because, as all of us know, the industry is also involved in promoting illicit trade of cigarettes. So in general, we have a huge gap in monitoring. Regarding illicit trade, the only information by 2016 was provided by the industry. There was an overestimation, so data from the industry, the only source, was penetration of illicit trade estimated in 13%, and with the support of American Cancer Society last year, we, Fundación ANASH, performed an independent estimation of illicit trade, and the estimate was 3.4%, way below industry estimates, which is good. We provided evidence and generated evidence. And, but right now, the industry is also providing funding for the illicit trade observatory, where at the Association of Subnational Authorities. So clearly we have tobacco industry interference with tobacco tax policies, and but there are some good news. We are doing some actions to counter that. So what we are doing right now, first, is we are doing periodic monitoring that is decisive to eliminate asymmetries of information in our country. That's like the huge problem. But we are trying to eliminate those asymmetries of information, provided reliable and scientific information on taxes, on price, on tax revenues, consumption, and also illicit trade. I forgot it here. Second, we are generating relevant evidence. And we have learned that having publications in scientific journals is way better, at least in our country, is more credible by the authorities than studies from the industry, because the industry always has studies that you can find just in presentation because are privately enough to not circulate to everyone. But yeah, this is another lesson. Try to get published in scientific journals so you have a strong evidence. Third lesson, provide information, but combine that with persuasion. So you can do some advocacy and try to motivate policymakers to change things in the country. And this is something that we have been working very hard between the Ministry of Health and civil society. For a strategy that we have followed as a foundation is sometimes you don't have enough funding, but you need workforce to perform operational tasks. And this is a good example. If you are doing monitoring, you need some operational tasks. So we are using volunteers, students of economics. And the last one is also important. In terms of evaluation, it is important that you provide evaluation in terms of health, morbidity, mortality, but also consequences in the health system. And this is something that we are doing with the Salutia Foundation. Now, specific strategies by the ANASH to counter the tobacco industry interference. First, provide reports monitoring price evolution. We are, for this year, we have two reports. The second one is share information with the policymakers, share information with the ministry, with all institutions involved in tobacco tax policy. Third, generate and use evidence. And since we don't have many funds, we have been supported by two agencies. The first one is the Proactive Initiative by the American Cancer Society and UK Cancer Research. With those funds, we are measuring illicit trade in 2017. Since we had a tax reform in 2016, we are doing impact evaluation of the tax reform on illicit trade this year. And we are also characterizing the supply chain. And with funds from Bloomberg, we are creating and promoting adoption of tax policy monitoring and evaluation tools. And also, we are doing evidence-based tax advocacy. So those are our main results and our main strategies to counter the interference from the tobacco industry. This is our system of indicators for the tax policy. And that's it. So, gracias. And an additional comments, advertising. If you are from Latin America, please join the LA Network on Tobacco Fiscal Policies. You just need to send an email to this address. And also, if you want to meet me at the end of this session, I will have more information. Thank you very much.
Thank you very much, Norman. I think we can have the floor to raise one or two questions. What is the price elasticity?
Sure. Price elasticity, we have also generated evidence on that. So for developed countries, it's like minus 0.2. For developing countries, it's usually estimated at minus 0.4. We have some estimates in the country that is around minus 0.6, but when you control for illicit trade, that we also published a paper on that, was minus 0.7. So that's the price elasticity. Kind of high, but expected because usually you don't control for illicit trade on the estimation of elasticities.
What's the smoking prevalence in Colombia?
13%.
13.
The last time that we measured that as a country was in 2013, but we expect pretty much the same number for this year.
And could I ask the people in the back to, when you change the timer here, to set it for 10 minutes rather than 20?
That's important.
So we have 10 minutes to speak and a couple of minutes for questions. Okay? Thank you.
Thank you. That's it. Okay.
The next speaker would be Adila Ashen from Indonesia. His topic is going to be tobacco excise as a potential source of local health financing in Indonesia.
Okay, good afternoon. Actually, I will explain about the tobacco tax as health funding, as source of health funding. So if we are talking about tobacco tax, there are two sides: expenditure side and income side and expenditure side. So we are talking now about expenditure side, not on the income side. Okay, I'm a lecturer. I'm also a researcher from the University of Indonesia. I will explain first about the universal health coverage in Indonesia. Since 2014, we implemented universal health coverage, and this is the benefit of universal health coverage. The member of UHC, yeah, from 2014 until 2017 increased very much. Recently, it's around 178 million population coverage by covered by UHC, and I'm sorry, it is still in the Bahasa, yeah. But the message from this picture is that this is kind of the detail of the membership of the universal health coverage. But yeah, this is the primary healthcare uses in the universal health coverage era. In 2014, for the universal health coverage in the primary healthcare, only 66 million people, and in 2016, 120 million people utilize the public healthcare. So UHC has increased the access of health. Yeah. However, I'm sorry. But there is a problem with the universal health coverage. This is a deficit funding of UHC. Yeah. Expenditure more than revenue. Yeah. Estimated in 2017, this year, the deficit is 9 trillion Indonesian rupiah, or around 690 million US dollar. Yeah. And based on the law of the UHC management unit, there is a alternative to get or to mobilize other funding. So our suggestion is to use tobacco tax to fund the universal health coverage, especially to fund the deficit of the universal health coverage. So the objective of tobacco excise is to control cigarette consumption for public health. So this is from the expenditure side. Tobacco excise fund should be used for tobacco control and public health and its related activities like the universal health coverage. And this is the this is the recent current tobacco tax for local health. So, and this is the current situation, the current law regarding tobacco tax for health, but unfortunately is under the local authorization, the local power of autonomy. So we have two types of tax, tobacco tax. First is tobacco excise. Second is local tax of cigarette. The third is value-added tax. From the tobacco excise, this is tobacco excise, yeah, 2% from the tobacco excise revenue distributed to the producing province or producing tobacco farming, yeah, and from that 2% we can use for public health. But also from the local tax is started in 2014, yeah, and 2014. Local tax rate is 10% of excise. It is earmarked 50% for public health, yeah, but it is provincial tax, so the power to use is in the local authorities, yeah, the local authorities. So 50% is for health, but the implementation is not efficient. So this is the current situation, yeah. And we suggest the government to add more tax on cigarette. If recently there are 3 tax on cigarette, then we request the government to add the 4th one. We call it additional tax dedicated for universal health coverage. Yeah. And because we want to make the pipeline, yeah, the special pipeline to fund the deficit of UHC. Yeah. If we use the fund from the tobacco excise, and we have to compete with other sector. Yeah? We have to compete with other sector, with the infrastructure, with the education, and etc. And if we use the fund from the local tax, local cigarette tax, we will compete, or there is a complaint from the regional or from the local authority. Yeah. And there are another option. The option is like Philippines did. Yeah. The Philippines did the reformation of tobacco system, the simplification. Actually, Indonesian system is very complicated, 12 tier. Yeah. If we want to make it one tier, yeah, it has a potential to increase the revenue. Yeah. But it takes time. Yeah. It takes time because it will be to amend the law. Yeah. Every political process takes time. Yeah. So we request the government to add additional tax on cigarette dedicated for the universal health coverage, because universal health coverage is so important. Yeah. It has almost our target in 2019, every Indonesian citizen covered by UHC. Yeah. It's around 250 million population. Okay, so this is our simulation. Yeah. We have two type of cigarette. This is machine-made cigarette and hand-rolled cigarette. So we suggest the government to add the tax only for machine-made cigarette. 79% of market share. Yeah. So if we add 60. Yes, 60 is very small. Yeah, if we add 60 rupiah per stick, and with the production 340 billion, yeah, we have 340 billion stick production of cigarette in a year. Then the potential revenue is 16 trillion. Yeah, 16 trillion. It is more than enough to fund the deficit. The deficit is 9 trillion. So let's say we ask the government to add the tax by 60, and the government, let's say, agreed only 30, yeah, 30 per stick. Yeah. Then we can have like 8 trillion, and it is enough. Yeah. And so this additional tax will not compete with other sector. Yeah. Will not compete or will not have a complaint from the local authority. And also we minimize the noise from the hand-rolled cigarette, because hand-rolled cigarette is, there are 400 producer with 100,000 workers. So we only applied. We suggest the government to apply it only for machine cigarette. So yeah, this is like innovation to fund the deficit of the UHC program. Yeah. And with the local cigarette, with the local health, local public health, we can have from the tax law, the local tobacco tax, and from the tobacco excise. And this is the mechanism. Yeah, the mechanism. Yeah, actually, this from the Ministry of Finance, and then the BPJS Kesehatan is the management unit of the UHC. So the fund is from the Ministry of Finance direct to the ministry. From the BPJS Kesehatan, the management unit. And this idea, there is a rumor that this idea is supported by the intersectoral person. And there is a rumor also that before this idea come up, there is an idea. The similar idea is from the private insurer. So the private insurance want to apply in this similar kind, but they want to create smokers insurance using private insurance. There are 60 million smokers in Indonesia, so it is a big business. Yeah, and the industry has agreed. This is a rumor. Yeah. So we don't want that. We don't want that. Yeah, and we want the additional tax inputted in the UHC program. Okay, thank you.
Thank you very much. Please remain on the stage for some questions. I would want to use my kind of chair privilege to ask the first question. I just want to know what is the kind of funding structure in the universal health coverage, because I have been to Indonesia. I know that each province, they would have their own funding structure, and if you get additional tax, and how they're going to be given, distributed between the national level and the provincial level.
This is in Bahasa, but the type of fund, this is from the central government central government budget. So the government subsidize the poor and almost poor people, using the central government budget, and this is from the local government budget. The local government budget. There's also from the workers. This is workers receive wages. Workers who receive wages. This is the number of members. The number of members by type of members, and there's also workers without wages. Workers without wages, 20 million, and non-workers. So there is a government subsidy, from the central and also from the local, and also from the employee, employee who paid, and also from the outside that, let's say workers without employee, in the informal sector, they have to pay, they have to pay. So many kind, and this kind of fund, the additional tax. The idea is to tax on the cigarette, and then from that one, we will give it, the government will transfer to the BPJS Kesehatan, the management unit of the UHC. So let's say the need is 9 trillion. So if we add more, let's say 60 rupiah per stick, and then the potential is 16 trillion. So this is the idea. To set the pipeline.
Thank you very much. I know the complexity in Indonesia, many different health insurance schemes, but also there are the least kind of member who are rural farmers. Actually, they did not use much, but they're the most need group which might need more attention. Thank you very much.
The next talk will be Dr. Pranay Lal, and
thank you, Chairs. I'm going to talk to you about how tobacco industry gets invested into and how they invest into other sectors and what makes them so profitable. But what is essential is that we don't, as tobacco control advocates, we don't study and we don't analyze the financial sector, because that's the leverage that tobacco industry has. It's easy money. Let's look at tobacco industry, how it functions. But before we do that, let's understand tobacco is possibly the first screen when ethics or ethically conscious or socially responsible investments are made. And currently there are 4.1 trillion euros in terms of the total market, the financial market in assets and investments that are managed through SRIs. Now, what makes it very interesting is that SRIs are growing rapidly. They're growing rapidly, much larger than the volume of money that's floating in the markets. People are now convinced in the markets that SRI bonds and SRI investments are no longer as the initial belief was that SRIs are not going to pay as much dividend as other blue chip bonds or blue chip shares. But this is now being dispelled. SRI bonds and SRI shares are now as good or perhaps even better in terms of the returns that they give to people who invest in them. So we know that tobacco is something that SRI bonds essentially have to be declared if you want to be called an ethical company. Now, increasingly, several countries like New Zealand, Norway, and several other countries, and most recently Sri Lanka, have declared that by 2025, Sri Lanka would become an ethically investable country. This is very encouraging because what this means is that Sri Lankan government is no longer going to invest in tobacco and other sin sectors that they identify as sin sectors. And what this means is public money, which is something there to protect public good, is not going to be invested in harmful products. My research has been ongoing for a long time, and I do it on an annual basis. Whenever the data comes out annually, every November, December, there's banker.com gives data on the performance of the top 1,000 banks of the world, on how they have invested and where their portfolios have changed. This is a very exciting set of data, and if this is analyzed and analyzed over a long term, you get extremely interesting understanding of how banks are behaving vis-a-vis tobacco investments. I'm going to talk to you about, because the most recent set of data has not been released because it's not November yet, but I have data from last year, and until March 2016, I analyzed the top 50 banks from the year 2000 till 2016, and I found that the 42 of the top 50 global banks continue to support tobacco industry. Either they invest into tobacco industry or get invested into by tobacco industry. So the relationship is mutual. Either they are investing into or getting invested by tobacco industry. Now, what is very interesting is that some banks are incorrigible. For example, Citibank, HSBC, and UBS, in fact, they have special cells. They have a special cell for tobacco industry. They have a designated desk. They have a set of analysts who actually support the tobacco industry. So if you really want to look at how tobacco industry is performing, go to their websites, and you will find financial intelligence about tobacco industry, whether it's regional or even global. It's fascinating stuff. Even Wells Fargo, for example, has some very, very interesting data on tobacco industry, especially on PMI. Chinese banks are among the others because Chinese banks are now the biggest. There are 4 banks in the top 10, which are the biggest, are Chinese now. And they also continue to support not just tobacco companies within China, but also in Africa and in Korea. Now, we found that only 2 of the top 50 banks are among those who continuously ensure that they do not have any engagements with the tobacco sector. But the problem is that the next 50 had only 5 more banks. So in all, there are only 7 banks in the top 100 that have consistently shown that they will not invest in tobacco sector or get invested by tobacco industry. They don't hold any tobacco accounts. These banks are Standard Bank, Westpac, ABN AMRO, Standard Chartered, Nordea Co-op, and ABSA. But what is problematic is that occasionally regional branches or smaller branches or country offices of these banks have been truant or have been ignorant in investments, and especially in their mutual funds. So for example, the Nordea case, which happened in 2014, they launched a mutual fund in Europe, and they had listed both BAT and Philip Morris in it. Now, Philip Morris International. Now, once shareholders brought to their notice that you cannot include tobacco industries in your portfolio, they were immediately taken out. But there was this incidence which showed that tobacco was included in their mutual fund portfolio. So just to conclude, I think as we look at how governments invest in tobacco industry, that's a very, very serious problem, especially in terms of Article 5.3. We also need to be cognizant of insurance companies, pension funds, and private banks. It's something that tobacco industry advocates or tobacco control advocates should take cognizance of. And I think we need to develop an institution or a set of individuals who would research and pursue this research across all kinds of financial institutions, who can leverage or can make an impact on tobacco industry investments in the tobacco sector. And I think one way that we can do this is by ensuring that we keep a tab on the socially responsible investments that happen and track at least the banks that have committed themselves to SRIs to stay clean from tobacco stocks. Thank you so much.
Open for questions. Did you say that they can't control who buys their stock, though,
That's
right? So that's not an issue.
Well, so for example, in co-op, BAT has bought co-op stocks, but you can't say that we are going to exclude you. But what they do is they're able to control. They have a management ceiling on how much stock can be sold to a certain company.
Oh, I see.
Right? So for example, BAT has several financial companies. All these tobacco companies have 8 or 9 financial companies which are not called by the name of the tobacco company. For example, the company that I track most often is the Indian tobacco company called ITC, and they have a company called Middleton, which was originally owned by BAT. So if Middleton Financial Group buys stocks, you cannot prevent it. Right? So there are proxy purchases, and that is something that has not been defined yet in case of socially responsible.
Do you track, like in the United States, the tobacco companies have bought the food industry, for example, and so, there are many different things like that. Do you track that as well?
Yes, I follow the acquisitions of companies. The most recent, of course, has been Thornton's in England, which has been purchased by Philip Morris. A large share of it. That is a very, very important area to look at, because tobacco industry is using all its easy money. It's trying to park buying things like Cadbury's and Schweppes and things like that, or craft food.
Should we be identifying, as tobacco advocates, identifying that Kraft is owned by a tobacco company and we should therefore not buy Kraft?
Absolutely, yes.
Any other questions? All right, thank you.
I think Jeff had a question.
Go ahead.
Question. Right, yes. Yeah, you need to show that there is blood money used to buy a product. Like Thornton's is a loved product in the UK. But if you were to say that after rates are actually now tinged with a drop of blood, I think people will be very cautious when they buy it.
Okay, one more question.
So I think Jeff had a question or a comment.
Okay.
I just wanted to say what great work this is that Pranay's been doing for ages. It does raise a major sort of ethical issue, and the only other people that I'm aware of that are really doing anything on this is tobacco-free portfolios, which Bronwyn King is pursuing and has been for a while. But I think there's some great research questions in here too. Once we track the money, what is the impact? Because the money is helping to, expand the tobacco push into probably low to middle income countries. So what happens when we take the money out? Who puts the money, where do they get it from? And but I think it's still a denormalisation strategy. What do you think?
I think it starts with denormalization, but as the markets realize that it is no longer legitimate or even acceptable to invest in tobacco companies, it becomes more difficult for tobacco companies to attract investments. So they don't remain the blue chip company that they currently are. That's the aim, I guess.
I know. One last question here. Is there a website or something where we could learn which companies are owned by tobacco companies?
No, I think we should start one, I guess. Maybe Jeff should do that. Yeah, we should do that. Yeah, that's a great idea.
It's a great idea because we don't know that.
Yeah.
Okay. Going on to the, thank you. The next speaker is Dr. Syed Alam from Bangladesh, and he's going to talk observational survey to explore the situation of unregulated tobacco traders in Bangladesh.
Thank you. If you go in Bangladesh nowadays, you find that one thing very easily, that is the cigarette. In every step, the cigarette is available because the small vendor, there is no regulation. Bangladesh government passed tobacco control law. According to the law, all kinds of advertisement is banned. So all kinds of direct advertisement is not available. But the problem is that the small vendors, now tobacco industry using them for the indirect advertisement, and also their ability help smoker to find out this tobacco product very easily. So that is one of the challenge. Another is the problem that the Bangladesh government, the law has changed in 2013. So it's very difficult in Bangladesh to change again the law amendment. So it is very long-term process. So that's why we are looking for a process that how we can regulate it very quickly in a short time by the government or government agency. So that's why we take a project. It's called is a limited area. We try to regulate this group by the local government. So local government is more flexible, but local government is not habituated or friendly to take that kinds of initiatives. So one of our initiative to involve the local government, because local government, if the local government take that responsibility on the ground of public health, it will be very easy to implementation, monitoring, and other things. So we take a project in the initiative. There are 18 municipalities and 5 city corporation to regulate the small vendors. So that's the background, that why we do this observation. So the observation study was to generate evidence or the understanding that why the local, the small vendors should be controlled and how we can control it. So that was our initiative to understand the general. So there's a few things that if we can regulate the small vendor with the local government. So the main thing that the 3 components of the tobacco control law we can easily implement: a pictorial warning, advertisement ban, sale to minors. That provision we can easily implementation. So that's our one of the things. So that study I said previously, it is there's a very small area. We conducted the study in 18 municipalities and 5 city corporation, and that was the observational method, and we also discussed with them. We interviewed something. It's very not so larger sample size, but we get the very good result. That's why I want to share. So that's the sample size was 560. So mainly we target that on different type of small vendor in Bangladesh. We call it a hawker, very small. These people are move any places. The tea stall, if you go in the tea stall, you will find that one. So small and medium shop owners and also wholesalers. So wholesaler is very limited, but the problem is the hawker or vendor. Those people are easily. So that's the thing, that legal status we want to check that one, that 99% there people, they have no legal status for the tobacco sales. But according to the local government act, if you run a business in local government area, you have to be a license, any product, any things you can sell. So but the small vendors, they have no licensing. So maybe any people tea stall, he is selling tea, but with that he also selling the cigarette also. Another finding is that was that one, when we asked them that they want to regulate or what will be the licensing, they're very positive response. Yes, more than 70% people say that one, yes, they want to regulate and it will be good for that one. We also try to justify their knowledge. That is the another part, that if they are aware about how tobacco harm. So that also very positive to find that one. Yes, they are also aware about the tobacco harmness and other things, but they also tobacco user. That also then we asked that one. so many questions, but that all the question is related to that when we develop the guideline that help us to generate and motivate that how we can convince the policymaker, like that people how they think that tobacco business should be legalized by authority government. People would be more aware about that the harmful. What the impact that one, we try to justify that one with this survey, but we also find that one quite good result on that one. So that is the one things we discover when we go that one. How tobacco industry using them. Wholesalers, different type of gift they receive from the tobacco industry. Tobacco industry encourage them how they can promote their tobacco. So small vendor also very quite high. So every people are getting different type of benefit from the tobacco industry. Like that, some people are getting small shop, some people getting this cash after their business and profit. So industry using their money, as I say that one, now the direct advertisement is banned, so the indirect advertisement, this money they're spending there. So that is also list of things that how industry provides signboard, commission, glass water, point of sale box, different things they are industry providing. So that we want to provide. Not only the vendors they are providing, they through the vendors they also providing the customers or consumers. So that is the another challenge we are working. That we also try to understand that their income. So when we go to the local government, that's to request them to impose tax. Local government said that they will be the poor people. So that's how we try to generate evidence that how much money they are coming. Selling. So this selling is very quite high. The hawker also earning. The hawker is small. They are earning 2,000 taka is good. Earning per day. Per day 2,000 taka is quite high in Bangladesh. Some area, mainly in. And also their profit is income is meaning that is profit per day is that 200 taka is small vendors, and the wholesaler is 600 is also very quite high. So that is a very good evidence that help us to motivate the policymaker. So then we also try to discuss with that the other partner peoples that who will be the authority to provide the licensing. In our mind, we know that the local government, but we try to justify that one, who will be the best person. So we get that the Ministry of Commerce, Ministry of Health, and other people name during our survey. And also this group found that one, they recommended that will be the right person who will be licensing we can involve. So when we start the project, then we, sorry. Okay. So what type of initiative, that also recommendation come from the different, when we go to interview different people, that one is stop selling single cigarette is the one of the challenge. So that is the one thing, giving advice, involve the other profitable alternative business, also one of the suggestion for that one, discussion to work for so many things. But the one thing that we found that one, the single cigarette ban. So that is the one things we received from the groups, that the single cigarette ban is the one of the important issues that we can do under this license. So what we do with this observational survey, we generate evidence and discuss with the local government, like the local 25 government officials, the 18 municipalities, 5 city corporation and tax force, and 22 parliament member of that area, with this evidence that okay, this is a profitable business, these people are doing profitable business, they are violating the law, everything we generate and sensitize them. And the result is that one, we have 10 municipality already adopted the guidelines, 70 municipality has taken decision, they will be adopted guideline, and license already issues 673 by the 13 municipality. The last point is that one, now the national government is thinking that they are going to introduce the national level initiative for the licensing. So now the local government is highly motivated. They are thinking to next year. We hope that the local government will be pass the order for all the local government institute that they are going to introduce licensing for tobacco control. So in Bangladesh, it will be very, very new initiative, because national government or sub-national authority involved the tobacco control, and that way it is one thing. Other thing that now the national government is working for the prepare the recommendation for the tobacco control law amendment. Already there is a joint meeting, so they also committed to include in the national law. So hope that in the 2018 or 19 when the new laws will be passed, tobacco control licensing including in the national law. Thank you very much.
Thank you very much. So let's see any questions, please. 1, 2.
The wholesaler, these people are not sell other things, only the tobacco. But the small tea stall, the hawkers, especially only the tobacco. But the small tea stall, they maybe tea, biscuit, and other things. A wholesaler also specifically on the tobacco. But the hawkers, they only tobacco. The small vendors. Like I say that one in the one university is called Dhaka University. So we found that the small kids are selling cigarette, all boxes are same. So we try to understand that who provided that one. So we discovered that one, that the BAT providing the support to the small children, they will sell cigarette in the university. So university is a big, so to buy the cigarette easily to the student, they are using that technique. So not only the Dhaka University, different universities, they are using that kind of technique.
So, two questions. The first one is, how far did you go in the supply chain? Because they didn't get the cigarettes from the tobacco companies. I mean, they got the cigarettes from somewhere else. So, did you go to the second level of the supply chain, or just the vendors? That's the first question. And the second one is, we have a similar problem in Colombia, South America. But I was wondering, how do you think that kind of regulation should be enforced, like by police, or what kind of mechanisms do you have in mind for enforcement?
Okay, the main things in the licensing, there is so many conditions. One of the conditions that one, how many licenses they will be issued, one thing. Second one, that one, where they can sell. Everyone asks for the license, the local government will not provide the license. So that is the one kind of restriction and limitation. So like that, now in the 18 areas, what we do, we ban the 100 meter of the schools, pushing local government to limit the licensing in the public places or hospitals, education institutes. So that kinds of limitation they are going to impose. Second question, the implementation. That's why we have to involve the local government, because local government has the two challenges. One of the general revenue, and also they are the right person who can easily check that these people are violating or not. So they have that is a separate authority. So that in the local government in Bangladesh now, the two groups can monitor them. One is the central government, they have the system for law enforcement, the police and other people, and also local government. So it's a two type of enforcement mechanism work on them.
I thought that Dr. Maldonado was asking, where do they get, and I have the question anyway, where do they get the cigarettes from? Do they, they just break open a package and sell them individually? Is the tobacco company, do they like that because they sell more? Or do they sell handmade cigarettes that they get themselves?
That from the they purchase from the wholesaler. The tobacco industry, they have the agent, and then wholesaler, and then wholesaler, and then the local. So there's a separate step. But the tobacco industry directly provide the support to their agent, that they will be support different way to the small vendors. Some promotional activities that they can easily sell, they are involving this position. So tobacco company indirectly support that chain.
So just a follow-up question. So you don't have like mafias involved in the supply chain?
No, that's a mafia. No.
Thanks. I just had a question. It's a difficult one, but about the impact of kind of the licensing on the hawkers' livelihoods, because those people are normally not the richest of people, are they? They're normally kind of scratching together you know, they're among the lower socio-economic classes. So, what kind of impact will the licensing have on their? It's a bit of a devil's advocate question, but.
Okay, how the licensing?
Does it risk pushing them further into poverty?
How the licensing will impact? What is the question? How the okay? That the one thing that one the problem that one we have to bend the point of sale advertisement. And second thing, the limitation of the selling. If you go, that's why I say that if you go in Bangladesh, in the every step you will get the cigarette. Now in tobacco industry, providing different type of cigarette. When the young people are sitting there, they are providing support that the smoker the wholesaler will go and sell their cigarette, and they are appointing like the girls that push the young people to purchase the cigarette, the women wholesalers. In the some areas, but in the city, the kids, mainly kids and young people selling the wholesaler. So the main target is to control about that one, the selling. The main thing that any people can sell. You're running a tea stall, you can sell cigarette. You are running another shop. You're not, so you have to be seek another permission. So that's one kind of restriction to keep them away. Like that, we ban they can sell in the 100 meter of the school. No license will issue if there is any 100 meter area of the schools. So that is not covered now the national law. So we go through the subnational order. So that kinds of is one kind of a regulatory mechanism. I don't say that it will be 100% work, but two things we can easily prevent. One thing that one the tobacco control law 3 part. I say that one sales to minor, tobacco advertisement. POSO is one of the challenges, and third one is that one the picture warning. So 3 provision is we can easily implement it if we can include them in the licensing system. So licensing is not, it is a part of that all activities. It's not it will not only one way that it will be may make a big impact to reduce tobacco control.
Okay, thank you very much, Saeed. The next speaker will be Safdandin Ahmed from Bangladesh, also talk about some actions, the counter tobacco companies' interference by the civil societies and media.
He's not here.
Okay, so how about we go to the next one first, and while waiting for him. The next one would be by Valesca Figueiredo from Brazil to talk about use of tobacco in Brazilian reality shows, the status and the potential influence on the low-income population. Valesca. Yeah, she's okay. So in case of that, why not we can open the floor for the question for the previous 4 speakers. I think there's also an interest to discuss about, in the last presentation.
I have a question while you're getting up on for Mr. Ashan. Is it easier to deal with the national? You said that the local government, the tax, they keep it themselves or they don't spend it for health. Is it better to deal with national, to have tax and on a national level or a local level? Is it more likely to get back to health care if it's on a national level rather than a local level?
Okay. I think it's better to manage by the national level. Just like in Thailand, there is a Thai health center who managed, I think, 2% of the tobacco or of the excise revenue for the public health. But in Indonesia, the context is for the autonomy, the local autonomy. Yeah. So the local government want to get that money from the excise, from the tobacco excise, and So there are two things. The first thing is from the tobacco excise sharing revenue. Yeah, this is 2% of the excise, tobacco excise, distributed only to the producing province or producing municipalities. And one of the objective or one of the allocation is for public health. So this is in the local level. And the second mechanism is from the local cigarette tax. From the local cigarette tax, it is applied to all province and all municipalities and cities. 50% from the local cigarette tax earmarked for the public health service. This is potential, it has a potential. However, it is still in the power of local authorities. So if the local government, if the governor or the mayor has no public health sensitive, yeah, then this money will disappear. Ideally, this money will add on the public health budget in the local budget. But in fact, yeah, most of them is substituting. Yeah. So there are many things. Yeah. So there is more on local, but the management of the local government still need to be revitalized. And so I think it's better with the Thai health in the national level. So the 2% give it to in the central government.
Sorry, I just have a follow-up question to that. Similar to that, in other countries, how would you document the sale? For example, the tobacco could be sold by some small vendors, while there would be no tax recorded. Well, even you have the tax money, but the money would not actually be collected and goes to the pots of the government.
I'm quite sure that our system of taxation administration is quite good. Yeah, we have tax stamp, and every cigarette is being excised. Yeah, so it covered all. Yeah, and so the number of production 340 billion stick in a year is based on excise ordering, So illicit cigarette or hand-rolled or not recorded cigarette is not very high in Indonesia because it is affordable, still affordable. Most of the smoker bought the high price cigarette. So 80% they bought the high price, not the low price. Yeah, and yeah, the big company market share is 80%. So this is the fact.
There was some more. Isan?
Yeah, I think it's well documented and all of us know for sure that tobacco industry interferes in all public health policy. It's not just tax, it's any kind of policy that we have. And that the only instrument that we have is Article 5.3, and we want to hold them accountable on 5.3. But I have a question from the people who are working on taxation. When does it transfer itself, or what's the line between a breach of Article 5.3 or public health policy interference to simple tax evasion and fraud? Because that can be easily tackled because there are lots of laws in each country on tax evasion and fraud. So is there a line between the two? Is it the same? Or which is the easier one to approach? Because we don't have any Article 5.3 national laws in any of the countries that I know of. There are bits and pieces of it. But there are tax evasion and tax fraud laws in each and every country that exists. So I'm just wondering, what is the approach that we need to take to bring, as we said, to hold industry accountable?
Go ahead.
One of the things that we need to take note of is that if you look at capital flight of among all industry, after gun makers, it's tobacco. So Action 8 comes up with a report every year on tax havens. And you will notice that BAT and PMI are in top 10. And the other 8, of the other 8 that remain, would be 5 of them are usually defense companies. And notice that BAT, JTI, and PMI are in one line in Geneva. And it's very thoughtful of them that, and they've put a lot of thought behind this. They are establishing themselves now in Cayman Islands, British Virgin Islands, Mauritius, New Zealand now. New Zealand's become popular because it's a tax haven. So, so this is a typical trait because the money is so mobile now. They're able to park money through investments, and and they are registered in so many ways in so many companies that they shuffle around. And governments cannot, they're not smart enough to understand this. And they also create shell companies which suddenly dissolve into another entity. It's something that we have not kept track of. We need to understand how this whole beast evolves. It's like a contagion. It's filling up a room and it's evolving into several different types of microbes and at great speed. So, that's the reason why you need to also understand how finance is driving this evolution of tobacco industry. There are audits, but if you are creating multinational companies and you're creating shell companies and accounts in other countries like, say, Panama or wherever, you don't have to disclose how your money is getting transferred because everything is through electronically now. However you transfer it, it's getting through several layers and bypassing so many checks and balances that you just escape all of that, right? So, for example, one of the things that you're talking about is illicit trade. We very well know that British American Tobacco and Philip Morris, or Gudang Gurung, Sampurna, for example, how is it so widely available in India, right? Now, they don't have the excise stamps and banderoles and everything, but it's available in east part of India, massively. So we need to understand it's the same industry, it's benefiting through illicit trade as well, So, and where is that money getting parked? Who's benefiting? How are they accounting for that illicit trade? It's a huge amount of money, right? Sorry, I've taken too much time.
I think that's a very important issue because of financing, the way of the financing, you have so many kind of layers of different investment. So it's very hard to track who exactly is investing what. But I would agree if you can put something, you can monitor online about what the banks are doing for direct investment. For example, lots of people like me, I'm not going to use HSBC.
Regarding the tobacco industry interference in tobacco tax policy, unfortunately, sadly, in the excise law, Indonesian excise law, it is stated that the government must consider the aspiration of the industry in setting the tariff. Yeah, so it is stated in the law. So the government, to be frank, must consult with must consider the industry aspiration. So that's why we request the government to amend the law. Yeah, I think it's still a way to go because politician now is more pro on tobacco industry. In Indonesia, there is also a ridiculous regulation that there is a maximum excise tariff. The maximum allowable excise tariff is 57% of the retail price. Yeah, it is the maximum level, 57. It is stated in the law. I think in this room there is no such a thing. Yeah, this is only in Indonesia. Yeah, and this is to show that this is the interference is very high in the law, in the legal law, not the illegal one. This is the legal law. Yeah. So.
Yeah, please don't misunderstand the comment that I'm going to make. It's all for the benefit of everybody, but just to jolt you a bit. For decades, we have been riding a high moral horse. Like, we have the high moral ground. But my feeling is that was true when we were only discussing health. And we said tobacco causes death, etc., etc., etc. But when we talk to the financial people, and please excuse me if there are any financial people here, or if you want to quote me in front of any financial folks, they don't rely on moral and ethical values. They understand dollars, they understand the currencies, they understand profits, they understand shares. And go and talk to them about Article 5.3 and how ethically important it is not to talk to the industry. It just goes through one ear and out the other. So maybe it's time to rethink our strategy on, should we persist with Article 5.3? We should with the Ministries of Health, because that's really, really important. But how do we deal with taxation and Ministries of Finance and investment bankers and shareholders? And how do we, what is our baseline? What do we say when we go to them? The tobacco kills, I guess it kills, so, but it's earning a huge profit and it's coming from a legal industry which is paying us tax. So that's the problem. I think that's the hurdle that we need to cross and come to terms with and decide that what do we want to say to a Minister of Finance? It's because he's not concerned about the health. And this argument of you will save when you save all these people and this will be good for the economy, and all that has, as I said earlier, moral and ethical issues are related to it. But if you want to talk to finance people, we need to come up with better arguments than what we have currently. And that's why I feel that we are losing on this tax debate and investment banking and all the other stuff that I just don't understand. So we need to kind of take this forward somehow.
I take that as a challenge to the tobacco control individuals that in addition to listing all of the companies that the tobacco companies own, if we raise the moral stature of being against tobacco, maybe we can convince these financial people, or we can turn them against tobacco like we've turned the ordinary people who, many of my patients anyway say, well, I don't smoke anymore because it's not cool to smoke. Everybody looks at me and they say that I stink or something like that, and they can't do that. So if we could turn that into the investment community, somehow make it unappealing to them, or to realize that they're bad guys, if you would use that word to do that. I just have one other comment. When you said about Dr. Lal said about the complications of tracking the industry, because I know that, I think it was Reynolds or somebody bought Kraft, but then, no, Nabisco owned them first. They were also, Reynolds owned Nabisco, but then Heinz bought Kraft. So now Kraft is no longer owned by whatever Reynolds or whichever tobacco company it is, but do they still have a lot of investment in that? The whole thing is very complicated. So if you come out and say, don't buy Kraft because they're owned by the tobacco company, well, they're technically not any longer owned by a tobacco company, but they may still have, 30% or 40% or something like that investment in it. Very complicated.
There's a super company called Antria, which actually...
Yeah, Antria. They changed their name to make it sound better. I think, if there are no further questions, so we'll be adjourned, I think. Any other questions or comments? Thanks to all of the speakers and the audience, and very good. Thank you.